The knees are the most common thing that we treat. It seems like everybody's knees tend to go out on them at some point. The most common thing is arthritis. Now, arthritis means the cartilage is breaking down. That's the cushioning right there at the joint, right? So with cartilage, if it's stage 1 or stage 2, meaning you catch it pretty early, usually it's a one and done type treatment. Now, if it's further and it's worse, stage 3 or stage 4, it could take multiple treatments. And we don't recommend coming back for, minimum 6 months, but most people at least a year. But the cool part is even 3rd or 4th degree arthritis, which are the bad stages, we can usually get at least 1 to 2 levels of improvement, meaning stage 3 to 2 or 1. I've had a few rare cases that were 100% with one at stage 3, but stage 4, best case, 3rd to 2nd degree. So in this video, you're going to see my father-in-law, Nacho, doing his knees, and he was pretty much bone on bone. So we did his knees a couple years ago, and even with that, he's been great. He's still maybe like stage 3, stage 4. There was a little bit of improvement, but it did get rid of all the inflammation, and he's been pretty well pain-free ever since. So lately he's been walking his dogs, running on the beach and stuff, and they're kind of getting a little sore again. So we're gonna do him again, hoping we can improve him, maybe to stage 3, stage 2. And, he might need another treatment in another year. It's unfortunate. We wish it was like faster one and done, but look, he's in his early 70s and he's been hard on his knees. And this is just what happens with people. Now, they can also help with meniscus tears. That's the first thing I ever personally fix. I even fixed some partially torn ACL, MCL, PCL, so ligaments, tendons, cartilage, meniscus. We can fix all these tissues, but it does depend on the degree of how bad they are. So